In the third of a series of messages to GHA doctors setting out his view of the issues at the authority and attaching relevant documentation and previous emails, Dr Dr Burke revealed details of what his team had assessed as preventable deaths and other failures in quality of care, as reported on by GBC this week. However, Dr Burke's emails emphasise that in his view the problems extend beyond individual mistakes and are the result of systemic failures at the GHA in dire need of addressing. In an email to the Chief Minister in 2020, he said that while the GHA is not subject to assessment by the Care Quality Commission as NHS hospitals are, it should ideally rate as equivalent to the CQC ratings of outstanding or good. Instead, Dr Burke said, based on his observations over 18 months, the GHA would be rated as inadequate in the NHS and would be subject to special measures. Dr Burke said there was little or no formal risk management infrastructure or valid data with which to benchmark the GHA, adding that as a consequence there were few areas his team had looked at where there weren't deficiencies leading to risk to patient safety and quality of care. Dr Burke refers to the infamous Mid-Staffordshire hospital scandal, where an unusually high number of deaths at a small general hospital led to an investigation which uncovered shocking evidence of poor care. He says many of the themes identified in the public inquiry chime with the current situation at the GHA. The mid-staff scandal made national headlines in the UK. The then Health Secretary Alan Johnson said there had been a complete failure of management to address serious problems and monitor performance. In terms of addressing these issues, Dr Burke said the patient care agenda was dominated by the priorities of different professional and self-interest groups and individuals, with initiatives to improve patient safety and quality of care opposed and those proposing them targeted when they come into conflict with these interests. Dr Burke cited concerns by Minister Sir Joe Bossano over financial control at the GHA, but argued that trying to take money out of an already unstable organisation with patient safety issues was highly risky without clear assessment of its impact on quality. He also took aim at the outsourcing of services which he said could be provided in the GHA in a safe and cost-effective way. In a further letter to the Chief Minister, Dr Burke recommended a structural transformation of the GHA, with the recruitment of a small team from the NHS to assist and the employment of a chief executive from the government or the NHS. He said former Minister for Health Neil Costa had begun a process akin to special measures, but that this process had not been completed after he stepped down, with a subsequent lack of clarity in the management structure. Dr Burke presented a strategy which included a proposed new GHA management structure. Among his recommendations was the separation of the role of CEO and medical director, and the appointment of 3 medical directors, one each for the 3 main areas of healthcare. He also called for a complete review of the mental health service, which he said needed the appointment of an experienced psychiatrist who has worked as a medical director or chief executive of a mental health trust from the UK. Dr Burke also proposed changes to union legislation in Gibraltar to bring GHA unions into what he called alignment with Unite UK. He proposed different unions for managerial and non-managerial staff to avoid conflicts of interest. He also called for a review of pay and allowances and for more structured mandatory training and personal development reviews. Dr Burke called for the Nursing Administration and School of Nursing to be allowed to select candidates for training, and for a review of what he said was a policy of terminating Spanish nurses' contracts when they are close to 3 years' tenure. On clinical governance itself, Dr Burke called for a formal risk management structure to be put in place, with standardised policies and procedures. And he called for the establishment of a health and social care regulatory body in Gibraltar, along the lines of the Care Quality Commission, for the regulation of the GHA, pharmacies, private clinics and non-medical healthcare providers. GBC will bring you more on the information provided by Dr Burke in the following days, including what he claims are the multiple instances where concerns were raised but not acted on.